In this video, we will answer a very common question among international doctors. Is USMLE useful if you want to work in Dubai and the UAE? There is a lot of confusion online, with many doctors assuming that USMLE is required for UAE practice. However, the reality is more nuanced and depends on licensing requirements, career goals, and job level. One of the most widespread myths is that USMLE is required to work in the UAE. This is simply not true. The UAE licensing system is separate from the United States system, and passing USMLE alone does not grant eligibility to practice in Dubai or other Emirates. To legally work as a doctor in Dubai, you must obtain a UAE medical license. This typically means a DHA license for Dubai or DOH license for Abu Dhabi or MOH license for other Emirates. USMLE does not replace any of these licensing exams or regulatory processes. USMLE is a licensing examination designed specifically for doctors who want to pursue residency and medical practice in the United States. It evaluates medical knowledge, clinical reasoning, and readiness for the US healthcare system. It is not designed as a licensing pathway for the UAE. That said, USMLE can still be very useful as a strong addition to your CV. Passing USMLE demonstrates a solid medical foundation, strong clinical knowledge, and the ability to succeed in a rigorous international examination system. This can positively influence how employers perceive your academic strength and discipline. In competitive job markets, especially in top private hospitals or prestigious institutions, USMLE may provide an indirect advantage. It can signal higher academic commitment and international exam exposure. While it does not guarantee a job, it may help strengthen applications for higher quality positions compared to candidates with similar experience levels. It is very important to understand that USMLE does not replace the DHA, DOH, or MOH licensing exams. Even if you pass all USMLE steps, you will still need to meet UAE licensing requirements, including credential verification, eligibility assessment, and local licensing examinations where applicable. From a practical perspective, UAE employers usually prioritize recognized medical degrees, completed internships, relevant clinical experience, and an active UAE license. These factors often carry more weight than international exams that are not directly linked to UAE regulatory frameworks. At the specialist level, board certification, postgraduate training, and years of experience are typically far more influential than USMLE alone. Specialist recognition in the UAE depends mainly on training pathway and credentials rather than US licensing exams. Another important consideration is cost versus practical benefit. USMLE preparation requires significant time, financial investment, and long-term commitment. If your primary goal is to work in the UAE rather than the United States, this investment may not provide proportional licensing advantages. A balanced and professional perspective is essential. USMLE is not required for UAE licensing, but it is not useless either. It remains academically valuable, strengthens your professional profile, and demonstrates strong medical knowledge and exam discipline. In conclusion, USMLE is not necessary to practice medicine in Dubai or the UAE. However, it can still be a valuable CV enhancer and may support applications to competitive or top-tier roles, particularly in private or academically oriented institutions. If your long-term goal is the United States, USMLE is essential, but if your primary goal is the UAE, focusing on licensing requirements, clinical experience, and recognized qualifications will have a much greater impact on your career success.